I am Dr. Daniel, and today I need to tell you something about collagen that most people get completely wrong, and it's costing them their joints, their bones, their skin, and their longevity. You're probably already aware that collagen is the most abundant protein in the human body. It makes up roughly 30% of your total protein mass. But here is what nobody tells you. Taking collagen powder without understanding one fundamental biological principle is, at best, a waste of money. And I'll explain exactly what that principle is. Let me start with a number that should stop you cold. By the time you turn 25, your body's natural collagen production begins to decline, at a rate of approximately 1 to 1.5% per year. By the time you reach 50, you've potentially lost 25 to 35% of your baseline collagen capacity. Researchers at the University of Michigan have shown that this decline is directly correlated with skin thinning, reduced joint cartilage volume, decreased tendon stiffness, and loss of vascular elasticity. So, collagen matters enormously. But supplementing it alone is not the answer. Here is the principle that changes everything. Collagen is mechanosensitive. That means collagen synthesis, organization, and deposition are all governed by mechanical signals, physical forces applied to your tissues. Without those signals, the collagen you consume is broken down into its constituent amino acids, mainly glycine, proline, and hydroxyproline. Those amino acids are then distributed by your body however it sees fit, often redirected to energy metabolism, not tissue repair. A 2019 study published in the American Journal of Clinical Nutrition showed that participants who consumed 15 grams of collagen hydrolysate 60 minutes before exercise had significantly higher levels of circulating hydroxyproline and glycine, the exact building blocks for connective tissue synthesis, compared to those who took collagen at rest. The exercise plus collagen group showed measurable increases in collagen synthesis markers in tendons. The rest group did not. This is the core insight. Collagen needs a mechanical address. Motion tells your body where to deposit those amino acids. Without motion, the bricks exist, but there is no architect, no blueprint, no construction site. And before we go further, let me add one more point about the collagen you consume. The average Western diet provides between 1 and 3 grams of collagen per day, mostly from trace amounts in muscle meat. But your body needs between 10 and 15 grams per day to meet baseline demands for tissue maintenance. People have stopped eating the skin, the bones, the cartilage, the tendons, the parts of animals that were historically rich in collagen. Slow-cooked broths, whole roasted animals, organ meats, these were the dietary pillars of collagen intake for most of human history. Now they've been replaced by boneless, skinless chicken breasts and protein shakes. The gap is real and significant. So, where does this leave us? You need the raw material, collagen plus vitamin C, which I'll explain in a moment. And you need the specific mechanical inputs tailored to each tissue type. Let's go through each one. Bone. Your bones are not static mineral structures. They are living, electrically active tissue, and the electrical component is crucial to understand. Every time you walk, run, jump, or compress your skeleton under load, you generate something called a piezoelectric current. This is the electrical signal produced when crystalline structures, in this case hydroxyapatite, the mineral matrix of bone, are placed under mechanical stress. This piezoelectric effect was first described in biological tissue by Japanese researcher Eiichi Fukada in the 1950s, and subsequent research has confirmed that osteoblasts, the cells that build new bone, are directly stimulated by these electrical currents. This is why immobility destroys bone faster than almost anything else. Bedridden patients lose bone density at a rate of approximately 1% per week. Astronauts in microgravity lose 1 to 2% per month. But a sedentary person on Earth who simply doesn't load their skeleton is not far behind. The mechanical signal is absent. The piezoelectric current never fires, and the osteoblasts receive no instruction to build. For bone, the mechanical inputs are weight-bearing and impact. Research from the journal Osteoporosis International found that brief, high-impact loading, as few as 10 to 20 jumps performed 3 times per week, significantly increased hip bone density in pre-menopausal women over a 16-week period. The key is ground reaction force. Walking is good, running is better. Jumping and resistance training targeting the hips, spine, and legs are best. Practically, 5 to 10 explosive jumps or heavy compound lifts such as squats and deadlifts, 3 to 4 times per week, with substantial rest between sets to allow the piezoelectric signal to reset. Bones respond to intensity, not volume. Nutritional cofactors. Vitamin K2 directs calcium into bone matrix rather than arterial walls. Magnesium is required for the enzymatic conversion of vitamin D into its active form, which in turn regulates calcium absorption. Without these cofactors, your bone-building machinery stalls even if the mechanical stimulus is present. Tendons. Tendons connect muscle to bone. They are dense, cable-like structures made almost entirely of type 1 collagen organized in parallel fibrils. And, unlike muscle, tendons have extremely poor blood supply, which means their nutrient delivery, including collagen precursors, depends heavily on mechanical loading to stimulate local circulation. The research on tendon collagen synthesis has converged on 2 types of loading: isometric and eccentric. Isometric loading, contracting a muscle without changing joint angle, produces substantial collagen synthesis in tendons with minimal joint compression. A 2015 study in the Journal of Applied Physiology showed that 4 sets of 45-second isometric holds reduced tendon pain and increased tendon stiffness significantly over 4 weeks in patients with patellar tendinopathy. This works by stimulating tenocytes, the cells that produce tendon collagen, without the shear forces that aggravate damaged tissue. Eccentric loading, resisting a load while the muscle lengthens, is arguably the gold standard for tendon remodeling. The Alfredson Protocol for Achilles Tendinopathy, published in the American Journal of Sports Medicine in 1998, showed that 3 sets of 15 eccentric heel drops performed twice daily for 12 weeks produced complete recovery in 90% of chronic Achilles tendinopathy cases that had previously failed conservative treatment. The mechanism is collagen fiber reorganization under tensile load. Practically, for any tendon you want to strengthen, perform slow isometric holds of 30 to 45 seconds and slow eccentric contractions, lowering a weight over 3 to 5 seconds. Take collagen 45 to 60 minutes beforehand. This is not optional if you want measurable results. Ligaments. Ligaments connect bone to bone. They stabilize joints and prevent dangerous ranges of motion. Unlike tendons, ligaments are not designed for high-tension force transmission. They are designed for stiffness at the extremes of joint motion and for proprioceptive feedback. This is why the training stimulus for ligaments is fundamentally different. Ligaments respond primarily to 2 inputs: joint instability and end-range loading. Research from the journal Clinical Biomechanics has shown that balance training, particularly unstable surface training, significantly increases ligament stiffness and mechanoreceptor density in the ankle and knee. Single-leg stance with eyes closed is a foundational drill because removing visual input forces the ligament's mechanoreceptors to bear the full proprioceptive load. The ligaments literally become denser and more reactive with repeated exposure to unpredictable forces. End-range loading is the second stimulus. Bringing a joint to its full range of motion and applying low-level resistance, such as resisted neck extension or resisted hip external rotation, causes the collagen fibers in the ligament to be recruited and remodeled at their full length. This is how you prevent the stiffening and shortening of ligaments that occurs with age and disuse. Intervertebral discs. The discs between your vertebrae are among the most collagen-dense structures in the body and also among the most avascular, meaning they have virtually no direct blood supply. They receive their nutrients almost entirely through a process called imbibition, compression and decompression cycles that pump fluid and nutrients in and out of the disc. This is why prolonged sitting is so catastrophic for disc health. When you sit for extended periods, the disc is held in sustained compression with no pumping action. Nutrients cannot enter. Waste products cannot leave. A 2016 review in the European Spine Journal documented accelerated disc degeneration in sedentary occupations compared to physically active ones, even controlling for age and body mass index. The mechanical inputs for disc health are axial distraction and rhythmic flexion-extension. Hanging from a bar, using your own body weight to decompress the spine, creates a distraction force that physically separates the vertebrae and allows fluid to rehydrate the disc. Inversion therapy achieves a similar effect with greater magnitude. Controlled spinal flexion and extension exercises, cat-cow movements, Mackenzie extensions, supported spinal flexion, create the pumping action that drives disc nutrition. A critical point: the discs in the lumbar and cervical spine are the most frequently degenerated because they bear the most load and are most subject to poor posture. These are also the areas where targeted decompression and mobility work is most urgently needed. Cartilage. Cartilage is the tissue that absorbs compressive load in your joints. Like discs, cartilage has no blood supply. It receives all its nutrition through synovial fluid, the lubricating fluid that fills your joint capsule, and that delivery depends entirely on movement. A landmark study from the journal Osteoarthritis and Cartilage showed that cartilage thickness and proteoglycan content, which reflects collagen organization, were significantly higher in physically active individuals compared to sedentary controls, even at identical ages. Chondrocytes, the cells that produce and maintain cartilage collagen, are mechanically activated. Compression stimulates them. Immobility causes them to go dormant. The clinical implication is profound. The most common advice given to people with joint pain is rest, but for cartilage, rest is atrophy. The correct stimulus is intermittent, low-impact compression. Walking, cycling, swimming, gentle range of motion exercises, combined with gradual introduction of end-range loading as pain allows. The joint must move through its full available range regularly. Stiffness is the early sign of cartilage and synovial deterioration. Treating stiffness with rest accelerates the deterioration it was meant to prevent. Fascia is the connective tissue web that envelops every muscle, organ, nerve, and blood vessel in your body. It is increasingly recognized as a sensory organ in its own right, rich in proprioceptors, nociceptors, and mechanoreceptors. And it is almost entirely collagen, specifically a dynamic mesh of type 1, type 3, and type 4 collagen that must be regularly loaded and stretched to maintain its pliability. Fascial collagen has a particularly interesting property. It responds to slow, sustained stretch more than to rapid movement. This is why yoga, tai chi, and deliberate fascial stretching protocols produce measurable changes in fascial thickness and stiffness, while rapid ballistic stretching does not. Research from the Fascia Research Congress has shown that slow myofascial release techniques produce local collagen remodeling detectable on ultrasound imaging. The most effective mechanical stimuli for fascia are rotational and three-dimensional: twisting, side bending, hanging with internal and external shoulder rotation, and moving through diagonal planes of motion. These stimuli load the fascial lines, the long tensional chains that run through the body, rather than individual muscles. Practically, daily movement across all planes of motion, sustained stretches held 60 to 90 seconds, and hanging from a bar for 30 to 60 seconds per session are among the most efficient fascial interventions available. Skin. The dermis, The deep layer of skin is approximately 70% collagen by dry weight. And unlike most connective tissues, skin collagen is highly responsive to local mechanical and thermal inputs. Facial expression is a genuine form of collagen stimulus. Research from Northwestern University published in JAMA Dermatology showed that a 20-week facial muscle exercise program produced measurable improvements in facial fullness and skin thickness in middle-aged women, as assessed by dermatologists in a blinded evaluation. The mechanism is mechanical. Repeated contraction and stretch of the underlying mimetic muscles stimulates fibroblast activity and local collagen turnover. Chewing is another underappreciated input. The masseter muscle and the mechanoreceptors embedded in the temporomandibular joint generate significant tensile and compressive forces that stimulate collagen production in the dermis and subcutaneous tissue of the face. The shift toward soft, processed diets has removed a substantial mechanical stimulus that shaped facial structure for most of human history. Thermal cycling, alternating heat and cold exposure, is also among the best-studied interventions for skin collagen. Heat increases collagen synthesis by upregulating heat shock proteins, particularly HSP47, which acts as a collagen-specific chaperone. Cold causes vasoconstriction, followed by reactive vasodilation, improving dermal microcirculation. A regular protocol of sauna or hot bath, followed by cold immersion or cold shower, creates repeated vascular and thermal stimulation that measurably improves skin elasticity and thickness. Blood vessels. The vascular wall, particularly the tunica media, is rich in type 3 collagen, which provides the elasticity that allows arteries to expand and contract with each heartbeat. As vascular collagen degrades and is replaced by stiffer type 1 collagen with age, arterial stiffness increases, a direct risk factor for hypertension, stroke, and cardiac events. The primary mechanical stimulus for vascular collagen is shear stress, the tangential force exerted by blood flowing along the vessel wall. High shear stress upregulates endothelial nitric oxide synthase, producing nitric oxide, which relaxes smooth muscle, dilates vessels, and stimulates vascular collagen remodeling. The most efficient way to generate shear stress is cardiovascular exercise. Brisk walking, cycling, and interval training all produce significant increases in cardiac output and blood velocity. A 2018 meta-analysis in the Journal of the American Heart Association found that 12 weeks of aerobic exercise reduced arterial stiffness by an average of 7% across multiple age groups. Nasal breathing during exercise additionally amplifies nitric oxide production. The nasal sinuses are the primary site of nitric oxide synthesis in the upper respiratory tract, and nasal breathing delivers this nitric oxide directly to the lungs and pulmonary circulation. The nutritional layer. All of this mechanical signaling is futile without adequate collagen precursors. The recommended intake for therapeutic collagen supplementation is 10 to 15 grams per day of hydrolyzed collagen peptides. The hydrolyzed form, collagen that has been broken down into smaller peptide fragments, has been shown to be absorbed more efficiently than intact collagen, with peak serum levels of hydroxyproline reached within 60 to 90 minutes of ingestion. Vitamin C is not optional. Collagen synthesis requires vitamin C at 2 enzymatic steps, the hydroxylation of proline to hydroxyproline and the hydroxylation of lysine to hydroxylysine. These hydroxylated amino acids are what allow collagen fibers to cross-link and form their characteristic triple helix structure. Without adequate vitamin C, collagen cannot be properly assembled. The clearest historical demonstration of this is scurvy, a condition characterized by collapse of connective tissue throughout the body caused solely by vitamin C deficiency. The gums ulcerate, wounds fail to heal, and blood vessels rupture because there is no functional collagen. The optimal timing for collagen supplementation is 45 to 60 minutes before your primary mechanical loading session. This window ensures that peak circulating collagen precursors coincide with the mechanical stimulus that directs their deposition. Several clinical trials, including a 2017 study from Penn State published in the American Journal of Clinical Nutrition, have specifically demonstrated this timing effect on collagen synthesis in connective tissue. A final word. Collagen supplementation is not a passive intervention. It is not a pill you take and then continue with your sedentary routine. It is an active biological conversation between a nutritional input and a mechanical signal. Neither works without the other. The tissues in your body are constantly remodeling, breaking down old, disorganized collagen and rebuilding it into new, aligned, functional structures. The rate of that remodeling and the quality of what gets rebuilt is entirely determined by the mechanical signals you give your body. Stop treating your body like a machine that needs oil. Start treating it like a structure that needs load. Load the bones, load the tendons, mobilize the joints, decompress the spine. Get off the chair, move in every direction your body was designed to move, and give your cells the raw material they need to rebuild. That is what I am, Dr. Daniel, and this is the evidence-based case for collagen done right.